So good afternoon and welcome to today's webinar, COVID-19 Protecting Voter Health and Participation in the 2020 Elections, brought to you by the Network for Public Health Law and the Voting Rights Lab. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office. I'll be your host for today's webinar. A quick note that this webinar will be recorded, so you will be able to access both the presentation slides and video playback on the network's website shortly after the conclusion of today's event. And we strongly encourage attendee participation and would love to hear from you. So feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A session towards the end of today's event. Your moderator for today's webinar is Lauren Bach. Lauren is the Senior Partnerships Manager at the Voting Rights Lab. She is a public health practitioner, organizer, and advocate for evidence-based state-level health policy, particularly family and reproductive health. Before coming to the Voting Rights Lab, Lauren managed state policy programs at Indivisible and at Physicians for Reproductive Health. She holds an MPH from Columbia University. Lauren will be leading us through the rest of today's webinar. So Lauren, over to you.
Thanks so much. Hey, y'all. Thank you again for joining. It is such a pleasure to be here with all of you. So I am going to introduce our wonderful panelists for today, and then we'll get started. First up, we have Dawn Hunter. Dawn is a Deputy Director with the network's Southeastern region. Prior to joining the network, she served in a variety of roles focused on public health policy and health equity. Dawn has worked in state public health at the New Mexico Department of Health, where she started as a Robert Wood Johnson Foundation visiting attorney in public health law through the network. She also served as Director of Health Equity, Policy Director, and Deputy Cabinet Secretary. During her tenure, she led a variety of initiatives to address health system innovation, and some of her core responsibilities included managing the department's legislative and policy activities, as well as strategic planning, performance management, and public health accreditation. Next, we will hear from Jiggy Ethelingham, who is the Associate Director of Campaign Partnerships at Voting Rights Lab, where she oversees the ballot access program and coordinates voting rights campaigns in multiple states across the country. Before joining the VRL team, she developed and managed the National State Advocacy program at Indivisible, but her background is rooted in science. She has a PhD in neuroscience from the University of California at San Francisco and used to teach undergraduate science courses as an adjunct professor at the University of San Francisco. And last, we will hear from Ryan Snow, who serves as legal fellow with the Voting Rights Project of the Lawyers Committee for Civil Rights Under Law. His work focuses on litigation and advocacy in defense of the fundamental right to vote and to ensure that all Americans have equal and meaningful access to our political process, regardless of race, wealth, age, language, disability, or other status or circumstance. At the Lawyers Committee, Ryan works with the Election Protection Coalition partners to identify and address barriers to voting access in states and localities across the country. So now that we have our introductions done, I am going to pass it over to Dawn to get us started.
Great, thank you, Lauren, and hello, good morning, and good afternoon, everyone. I'm excited to talk to you today about voter participation and election administration and how those things are affected by COVID-19. I'm really excited for today's webinar, so I hope you enjoy it and find it informative. Okay, so today I'm really going to give you a high-level overview of the impact of COVID-19, talk a little bit about the engagement or the connection between civic engagement and health. And then I will talk also a high-level overview of access, authority, safety, and security of elections, and then end with probably one of my favorite topics, engaging voters. Sorry, I'm having a little, okay, there we go. So first, this graphic is from the Utah Leads Together Volume 3 of that state's recovery plan for COVID-19. And I love this graphic, actually. The volume that this is published in focuses on instructions for high-risk individuals and addresses the impacts on multicultural communities. I like this graphic so much because it provides really clear examples of how COVID-19 impacts so many different aspects of our lives. The orange arrow is pointing to political engagement, which includes voter registration and turnout. And all of these things, if not being directly health related, impact health outcomes and behaviors. So what is political engagement or civic engagement? Definitions vary across studies, but this usually includes voting, volunteering, and membership in community groups. It is a component of social and community context, which is one of the 5 social determinants of health that's described in Healthy People 2020. And research shows that civic engagement is associated with self-rated health, a measure that allows people to identify their perception of their health at a given point in time. And it's a predictor of both morbidity and mortality in a population. Self-rated health can be measured in different ways. It can be non-comparative, which is what you see on the screen here, which is usually measured by asking respondents whether they would rate their health as excellent, good, fair, poor, or very poor. It can be age comparative. So would you rate your health as better, same, or worse if you were comparing yourself to people of your age? Or time comparative, where you're comparing your health to a given point in the past. What we know from existing research is that civic engagement, especially early in life, leads to increased social capital, enhanced social networks, greater wealth and educational attainment later in life, and overall better physical and mental health. There's a body of research just on the role of social capital in health outcomes that I'm not going to get into here, but it is one mechanism to improved economic and educational opportunity, among other things. And all of these things in the middle of the slide lead to improved access to health-related resources and behaviors, like income, healthy food, access to healthcare, physical activity, and safe and healthy neighborhoods. And those things, in turn, reinforce your access to social capital, stronger personal networks, better long-term achievement, and health. This is what we're going to call our high self-rated health group. I think I accidentally, there we go. I apologize, a little difficulty with the control on the side there. So the flip side of this is that people with low self-rated health, fair, poor, very poor, are less likely to engage in civic activities. And the people who are most impacted are people of color, people with disabilities, people with lower income and education levels, and youth. These are the same demographics that are less likely to vote or are more likely to encounter barriers to voting. In the public health world, we know that people with the greatest burden of chronic and infectious disease are Black, Indigenous, and people of color who have historical systemic barriers to achieving optimal health and well-being. The practical effect of this cycle is that people's voices are not heard through voting, community associations, the census, and other means of civic engagement. And that means that the people who are most impacted by structural and systemic barriers to health don't have a strong voice in how to dismantle those barriers. This means that those barriers stay in place and that they lead people to having low self-rated health, and it creates a vicious cycle. This cycle is supported by research on socioeconomic inequality and civic engagement specifically. We know, for example, that wealthier people vote at higher rates than people with lower socioeconomic status. In the 2016 election, over 76% of people with an income over $150,000 voted, while only 38% of people making less than $15,000 a year voted. In an analysis that was published by the Union of Concerned Scientists, socioeconomic distress was the single largest factor negatively associated with turnout in the 2016 election. Disparities in voter turnout has consequences for public policy, in that research suggests that elected officials may be more responsive to the preferences of voters over non-voters. And in a very recently published example from just July 1st, a study in the American Journal of Preventive Medicine showed that higher medical and non-medical financial hardships are independently associated with more emergency department visits, lower receipt of some preventive services, and worse self-rated health in cancer survivors. So health disparities and voting disparities have very real and significant consequences. I accidentally skipped a slide, so I'm going to go back to what I'm going to transition into, which is how this relates to the 2020 elections. I'm going to provide an overview of some of the important issues for this election cycle, including equity and accessibility, and what states are doing to ensure the safety and security of the election process. So here are some important stats to go along with this slide. 40% of adults have low literacy. 2 million voters have disabilities. 500,000 people experience homelessness in the US on any given night. More than 3.5 million students graduate from high school each year. 60 million people in the US live in rural areas. 4.8 million American Indian and Alaska Natives are of voting age, but 34% are not registered to vote. 2/3 of states require voter identification, but COVID-19 has led to the closure of departments of motor vehicles and delayed processing times, and people of color and young voters are less likely to have approved forms of ID. In local jails, the vast majority of persons are eligible to vote because they are not currently serving a sentence for a felony conviction. Problems with voting in jail disproportionately impact communities of color. 48% of persons in jail in the US are of African American or Latinx descent. In addition to identification, other barriers include language access issues, transportation limitations, which includes both access to polling locations via car or public transportation, and accessibility, like parking and proximity. Lack of online registration options, and time, which includes hours and days for early voting, and whether people have the privilege of getting time off of work to vote. The dominant concern right now is, of course, COVID-19, and states are taking a variety of actions to support the 2020 election. This includes delaying or postponing elections, granting emergency authority, expanding vote by mail or absentee voting, and changing signature collection requirements and filing deadlines. Under non-emergency conditions, there are 5 states that have vote by mail statewide. That's where all registered voters automatically receive a ballot. No excuse absentee voting, which is where voters can request a ballot for any reason, exists in 29 states and the District of Columbia. And in 16 states, voters need an excuse to request an absentee ballot, and that's actually a hot topic for litigation. So on this slide, emergency election authority varies across the US. A comprehensive overview of this can be found at the National Conference of State Legislatures website. But what you see here in green is the authority to delay or reschedule an election. Blue is the authority to relocate polling places, and yellow states have both of those authorities. About 20 states do not have any clearly defined emergency election authority. Of note, California, Florida, Oklahoma, and Virginia have the most expansive emergency election statutes. As just an example, California permits the changing of the location of polling places in an emergency, and it gives the Secretary of State the authority to set rules and procedures. And Oklahoma requires that the Secretary of the State Election Board declare an election emergency, which is independent of a declared state of emergency. And then when that happens, the Secretary of State has the authority to cancel or reschedule an election or provide a means to continue the election. This map here is important to the COVID-19 conversation because in a declared emergency, public health or otherwise, governors are often granted broad authority to suspend or change statutes and regulations. As the COVID-19 pandemic progresses, it is likely that many and perhaps all states will continue to have declared states of emergency, and governors can use their emergency authority to make changes to elections. To date, I think only Wisconsin no longer has an active emergency declaration, although that changes, and several state orders were set to expire this week, in fact, but many states are renewing their declarations at the moment every 30 days. In at least 14 states, the legislature has granted the governor power to suspend statutes and regulations. Those are green states. In 22 states, the governor can suspend regulatory statutes, which may include statutes related to elections, but that's not always clear. Those are yellow. And in 12 states, the governor can suspend regulations created by administrative agencies. Those states are blue. Kentucky is a little bit different in that they have granted their governor emergency power to modify an election, and upon recommendation of the Secretary of State, he can declare or she, by executive order, a different time, place, or manner for holding elections in an election area for which a state of emergency exists. 7 other states have granted their governor some combination of these emergency powers, and those states are in the lighter orange color. And you will note that Ohio stands out there as being the only state that does not grant its governor emergency power that falls into one of these categories. So here are a list of some of the policy considerations related to election administration. You're going to hear more about some of these things from our other presenters, but just a note on processing the increased amount of absentee ballots, requiring written contingency plans in case things change significantly by the time the general election rolls around, and considering alternative voting options for voters. So next, I'm going to talk a little bit about election safety and security, including current recommendations from the CDC, funding, and then specifically poll workers and polling locations. So CDC guidance, this is online. This is on CDC's website. I put this together in this nice little table here. But you can actually find this online. And so it's 4 different categories, and I'm not going to go through all of them, but I just want to point out a handful of the things in red. So in the first column, election officials and poll workers, that signs and messages to promote health and safety have to be accessible. They should be in multiple languages. They should be in Braille. They should be in audio if necessary. Really making sure that voters have access to the information they know to how to stay safe and healthy while voting. Under healthy environments, we've also seen modified layouts and procedures in some of the primary elections, but that's spacing out voting, the polling booth, making sure there's only one direction of flow for voting, for example. Healthy operations, alternatives for voters with symptoms, which may include separate polling sites, making sure that workers have PPE if they need it. And of course, curbside voting options. And then finally, what you're going to hear more about from Voting Rights Lab, providing voters the option and encouraging them to vote early or absentee. This is just a note about funding. The Help America Vote Act of 2002 authorized federal funds for elections. It also created the U.S. Election Assistance Commission, which helps states comply with the Help America Vote Act to adopt minimum standards on voter education, registration, and ballots, and make improvements to the administration of elections. The Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act, added $400 million to the existing $425 million that is allocated to states, but it requires a 20% match from states. You can see in this infographic here some of the ways that that money can be used, which includes purchasing PPE and cleaning supplies, training, and importantly, covering the costs associated with an increase in mail-in ballots. We saw in Georgia's recent primary that some of the issues included staffing and training issues and malfunctioning equipment. These election funds can be used to address exactly those kinds of problems. As a note, 23.1% of votes were cast by mail in 2018, but recent research from Pew indicates that 70% of voters support vote by mail for any reason, and it's being heavily pushed. Many states have spent nearly all of their additional election money that was allocated in the CARES Act. Poll workers are governed by state law, and all of these things here you can find. The Election Assistance Commission has a great compendium of all the state laws on this topic, but typically poll workers must be registered voters in the precinct or county or state that they are working, and they must be at least 18 years old. States are having to make adjustments, though, to account for poll worker shortages. As an example, in Texas, a failure to require masks and other measures is thought to be driving away poll workers, according to a recent article in the Texas Tribune, which means that sites may close, and that impacts some people more than others. A recent executive order issued in Texas that requires masks actually exempted voters over the concern that having to wear a mask would discourage voting. And that's certainly a concern that may have to be balanced with the health and safety risks. Another example is Florida, where Florida has also had poll worker shortages, and the governor signed an executive order authorizing administrative leave to state employees who work the polls. So this slide just shows you that the majority of poll workers are in the US are over 60. So this is one of the main reasons why there's a shortage of poll workers, because this group is at high risk due to coronavirus. One of the ways that that's being addressed is like states are actively recruiting students. North Carolina is an example of that. And also both major parties are recruiting and training poll workers, also helping to build the ranks. But in any election year, that raises concerns potentially about voter intimidation. Finally, Shelby County versus Holder, which was decided in 2013, eliminated the preclearance provisions of Section 4B of the Voting Rights Act of 1965. What that did was eliminate the formula to identify areas where racial discrimination in voting was more prevalent, along with requirements for prior approval for new voting changes in those areas. So what's the consequence of that? Between 2012 and 2018, more than 1,600 polling locations were closed, and states have limited voting days and hours. They've enacted new barriers to voter registration, and they've purged voters from the rolls. Changes that disproportionately impact communities of color. These changes also impact other marginalized voters, including low-income people and people with disabilities, who may have limited transportation options, difficulty voting during scheduled times, and barriers to obtaining approved forms of identification. These are the groups whose health is most significantly impacted by a failure to engage in the voting process. You can see here on this slide, on the right-hand side, on the left-hand side, the number of closures, and then the impact on Black, Latinx, and American Indian voters in the 3 states noted, Texas, Arizona, and Georgia. And you can actually see the full report for more detailed information on other closures. So one of the trends, as we have fewer polling locations, is to set up large vote centers. You can see here in this example from California, Secretary of State's office, that a vote center is a one-stop shop of sorts. You can register to vote, you can drop off your ballot, you can find elections materials in multiple languages, all kinds of things. 16 states currently allow jurisdictions to use vote centers on election day. And the advantages of that are convenience, potentially, cost, and maybe turnout, maybe not. Disadvantages include tradition may be lost for people who are used to going to a same polling location since they first started voting, or that they've taken their kids to, et cetera. Inadequate voter education on where to go and how to use the center, and technology issues, so whether or not vote centers are linked to other centers, whether or not they can print the appropriate ballots and have functioning equipment, et cetera. In 2018, almost 40% of voters used alternative voting methods, including early voting and vote by mail. That number is expected to increase significantly this year. Of those voters in 2018, Asian American and Hispanic voters were more likely to vote by mail or to vote early in person. This, of course, can vary from state to state, but it's important to note the differences in turnout. And last but not least, or probably the thing I'm most excited to talk about, is engaging voters and encouraging civic participation, because it's one of the strongest tools to address systemic and structural barriers to health. Voter registration overall this year has been down, so organizations are having to come up with creative ways to register voters. Just some examples here on the slide, one example here on the slide. High School Voter Registration Week is coming up in September 21st to 25th, to coincide with National Voter Registration Day on September 22nd. State laws vary on pre-registration for high school or youth voters who tend to have a registration gap, and that can lead to a lower overall turnout. But one thing we do know is that if registered, young voters do show up. We also know that between 2014 and 2018, the turnout among 18 to 29-year-olds increased from 20% to 36%. Integrated voter engagement is a strategy that integrates year-round, nonpartisan voter engagement with community organizing activities that strengthen the community ability to hold decision makers accountable, impact public policy, and build long-term power. I like the graphic that's here because it shows you all the ways that voters can be engaged around making change in their community. And one other way to engage voters is just to educate voters. In the example on the slide here from the organization When We All Vote, that was shared during the early days of the protest against the death of George Floyd, police brutality, and amid calls to treat racism as a public health crisis, voters were provided a breakdown of local elected officials and how they are connected to the criminal justice system as a way to link protest to advocacy. So that's all I have to present for you. I want to end with this, that ensuring that everyone can participate in our democracy and providing the tools to do so is an important health equity strategy. So I want to thank everyone. I know you're going to love our next two presenters, and this is a reminder from the CDC about ways to stay healthy, wearing a mask and maintaining distance as the COVID-19 pandemic continues. And now I'll turn it over to Jiggy.
Hello, everyone. I am Jiggy Athilingam. I'm the Associate Director of Campaigns and Partnerships at Voting Rights Lab, and I'm going to be talking to you today about a recent report that we just released along with our partners at the Union of Concerned Scientists and the UCLA Voting Rights Project. So in this recent report entitled Protecting Public Health in the 2020 Election, we tried to bring together both medical research and political science research to think through how to protect public health in the upcoming elections. So we overview the public health and medical data around COVID-19 and how it spread, and then how that might relate to potential spread in the elections if there is large amounts of crowding and congestion at polling places. Then we talk through the political science data around what we know can contribute to long wait times and congestion at polling places. And we talk through a little bit of examples from recent primary elections during the coronavirus pandemic that have taught us some lessons, both good and bad, about how to protect public health, and then end with some policy recommendations. So I'll be talking through these different topics today. So in the first part around protecting around the public health, I'm not going to go into too much detail because I know this is review for a lot of folks here, but we do talk a bit about how COVID-19 spreads. Of course, we know that it spreads through aerosolized droplets that are spread from people who are coughing, sneezing, talking, or breathing in a short distance. And one of the biggest risk factors, of course, is crowds and large gatherings, because large gatherings result in a lot of people being in very close proximity to each other for an extended period of time, which of course is a risk factor for spreading coronavirus. And we also know that there is a large number of asymptomatic carriers who can spread the virus without knowing it. Social distancing and masks are, of course, some of the two most important mitigation measures. On the left, you'll see the risk plotted against distance, so we know that the risk of spread drops off as you get further away from people. And on the right shows that masks can be helpful, of course, in reducing spread. As more people that use masks, and as masks are more efficient, it can help reduce the contagiousness. And we know that, unfortunately, coronavirus has not been impacting all populations equally. So we know that older people and people with pre-existing health conditions and people with low incomes are at higher risk. And specifically, I want to focus on people of color who are dying at a higher rate of coronavirus. So Black people are dying at twice the expected rate based on their national share of the population, and Latinos also account for a larger share of cases compared to their population. Additionally, Native Americans have faced huge outbreaks on tribal reservations, especially in the Navajo Nation. And this is particularly important when we think about voting, and Dawn spoke a little bit about this, but we know from data that communities of color tend to favor voting in person over voting by mail. And so this trend, combined with the heightened risk of COVID, means that if we don't conduct in-person voting safely in November, there could be disproportionate harm to the same communities who are at higher risk of coronavirus. And if executed poorly, in-person voting could lead to higher transmission. So in cases where we see long lines, extended wait times to vote, which often happens in Black and brown communities, which I'll speak about in a minute, if we have these long wait times, congestion, crowds, as well as that coupled with something else that Dawn also mentioned, which is that most poll workers tend to be over the age of 60, this could create a very risky situation. So we need to make sure that we are ensuring that all the in-person voting options are as safe as possible. And so we know that the way to reduce the risk of coronavirus transmission in voting in November is to make sure there is no congestion, crowds, wait times, crowding at polling locations. And so I'm going to talk a little bit about the political science research around what we know already about what can lead to long lines and crowds on election day. So firstly, there is a similar disproportionate impact of coronavirus on communities of color, there's also a disproportionate impact of long wait times in communities of color. So wait times have been highest among Black voters, and then secondly, in Hispanic voters. So like I said before, the same populations that are most at risk for coronavirus are also those to experience longer lines and wait times on election day already outside of the coronavirus pandemic. So we really need to make sure that we reduce the risk of coronavirus on election day by reducing the number of people that are at a polling location at any given time. And so the things that we know can help to reduce lines, wait times, and crowding, there's kind of 4 here, and I'll go through them. So first is the number of options. So the more options that people have to vote, the more that we can spread out people who are voting. So this means making sure that there is expanded access to absentee voting so that people are able to vote absentee, and so less people are going to be going in person. But it also means for in-person voters, because we know that there are always going to be people who either need to or prefer to vote in person, either because of language access issues, accessibility issues, or distrust in the mail system, or late ballots arriving. There's always going to be people who need to vote in person. So for those people, we need to expand the number of options that they have. So that means more polling locations, and it also means more early voting. And especially as it relates to early voting, in the same idea of spreading people out so that there are less people congregated in any given polling place at a single time. That means expanding the number of days and hours of early voting and allowing people to spread out over a number of weeks and across multiple locations, especially at nights on nights and weekends. There's also trends in terms of when people tend to go to polling places. So a lot of times early in the morning, people tend to go before work or right after work. And so if we are extending the hours so that they can go into the night and also on weekends, we can kind of reduce those crowds at those times that we know people tend to congregate in polling places. Third, we have points of service. So this means how many sort of check-in stations, voting booths, and machines there are in a single location. So if there is just 1 or 2 check-in stations versus if there's 10, you could easily see how that is going to impact how many people are waiting in line and crowding. So the more check-in stations and the more voting booths are available, the less people will have to wait in line and stand in crowds. And then finally, we have transaction times. And so that means that is talking about how long it actually takes to cast your ballot. So this, there's a number of factors that go into this, including the design of the polling place, how people are moving through the polling place, and also how well trained poll workers are. So this is an issue that's coming up in a lot of states, which is people are afraid to be poll workers, but we really need to make sure that we are focusing on poll worker recruitment and training, because we do know that the better trained the poll workers are, the lower the transaction time, and therefore the less risk of crowding. So in the 2020 primaries, we've had a range of experiences, and I'm going to highlight a couple of case studies that have kind of showed us the good and the bad of running primaries and elections during the coronavirus pandemic. So a lot of folks have probably heard about Wisconsin, which held its primary under a safer at home order on April 7th. Most other states had delayed their primary at this point, and the governor actually did try to move the primary, but then the Supreme Court intervened and said he did not have the power to do so. So there was a ton of voter confusion in the days leading up to it, and as well as a huge surge in absentee ballots, and some people did not receive their ballots in time, and so folks were forced to choose between their health and their vote. In addition to that, there was also massive precinct consolidation, and there was a mass closure of election day polling places at the last minute. So in Milwaukee, for example, where they usually have 180 polling locations, they only had 5. So you probably saw lots of photos and videos of lines stretching around blocks in Milwaukee, and that's due to the massive consolidation of polling places. So the National Bureau of Economic Research did a study where they compared they did a county by county comparison, and they compared counties that had above median numbers of voters per polling place to those that had below median numbers of voters per polling place. And basically the counties that had higher numbers of voters at polling places had COVID test rates almost twice as high in the 1 to 2 weeks following the primary, which is when we know that those positive test cases would show up. Additionally, Counties that had more relative absentee voters also had lower test rates of lower positive COVID-19 test rates. And the authors of that study estimated that for about every 100 additional voters in a polling location, that could be associated with an increase in the positive COVID test rate by about 0.4%. But not all elections that have been conducted during the coronavirus pandemic have had such catastrophic consequences. One example is Nebraska. So in Nebraska, the Secretary of State aggressively recruited constituents to vote by mail. So they proactively sent an absentee ballot application to all voters to try to make it as easy as possible to request an absentee ballot. And they also embarked on a very robust public education campaign to try to recruit people to vote absentee. As a result, over 75% of voters ended up voting by mail, and their participation actually broke a 48-year record high for primary turnout. Additionally, they did not close that many election day polling places, and poll workers also received sanitation kits and were instructed to follow strict sanitation procedures. And from all reports on the ground, there were not any real lines, and there were some places where, there were 3 or 4 voters per hour at some of these polling locations. So as a result, there was no crowding, and they were able to avoid a COVID spike. So the lessons we've learned from these primary studies kind of indicate a few things. So first, having more options for voters to cast ballots. Secondly, making sure that we're able to reduce voter transaction times, and also increasing the points of service for ballot processing. So then the policy recommendations that come from this report and this information are pretty straightforward. First is to expand access to absentee voting. Of course, we know that it is safest when people are voting at home. And there are 5 states that already mail all registered voters an absentee ballot for all elections. In the rest of the states, voters are able to request to receive an absentee ballot in the mail. And in 28 of those states, any registered voter can request an absentee ballot for any reason without needing to provide an excuse. However, there are 17 states which are considered excuse-required states, which means they only allow voters to request an absentee ballot if they have some excuse, like travel or sickness. Most of those 17 states have taken a step for the 2020 primaries to expand the definition of excuse to either cover pandemic or to allow the illness excuse to count for fear of coronavirus. However, many of those states have not yet acted for the November general election, so they will still need to expand that access for the November election. In addition, some states are doing what Nebraska did, which is taking proactive steps to encourage voters to vote absentee. So some states like Georgia, Michigan, Wisconsin, and Nebraska have agreed to mail absentee ballot applications to all voters. And then additionally, we have to think about how to lower the burden of voting absentee. So there are a handful of states where there are extra requirements to vote absentee, such like having to get it notarized or providing a copy of your photo ID or having to provide a witness signature, all of which are very difficult in the midst of a pandemic. If you live alone and you're over 65 and you need to get a witness signature, that could be an additional health risk. Same with getting a notary. And then if you don't have a printer and you need to go to a print shop to get a copy of your photo ID, that also can be problematic at this time. And finally, as it relates to absentee ballots, there's a number of kind of smaller policies associated with absentee balloting that really ensure that there's equity and access to absentee ballots. So that means accepting ballots that are postmarked by Election Day. A big reason that absentee ballots are rejected are because they arrive too late. And given some potential delays in the USPS, we need to make sure that any ballot that's postmarked by Election Day is able to be counted, even if it arrives a couple of days later. Providing prepaid postage so that people don't also have to go to the post office to get a stamp to send their absentee ballot. Ballot tracking, which allows voters to track their ballot, just like an Amazon package, through the process so they know when it's coming and that it's been received and counted. 24-hour drop boxes, which allow voters to drop off their ballot as opposed to mailing it in case it's getting close to the deadline and they need to make sure it's mailed out or that it gets counted in time. And finally, a cure process, which allows voters to repair any mistakes they may have made on their absentee ballot. And since we know this is going to be the first time that a lot of people are voting absentee, people may make mistakes. They may forget to sign it. They may forget to put the date on it. They may put their birthday instead of the date. There's all sorts of very easy mistakes that people can make on their absentee ballots. And several states have a process where voters are notified and allowed an opportunity to fix their mistake and have their ballots counted. And then, of course, we have to make sure that the in-person process is safe. And so, of course, one part of that is absentee balloting, because as we know, the more people that vote absentee, the less people that will have to go in person. And I kind of think about this the same way that I think about how we've dealt with grocery store shopping since coronavirus has started. So a lot of people have shifted to grocery delivery, but we did not respond to that by just closing all of the grocery stores. A lot of people have moved to delivery, but we've kept all of the same grocery stores open so that there is less crowds at any single grocery store during the pandemic. And we can think of voting as the same way. While we want to shift as many people as possible to absentee voting, if we respond by closing all of the polling places or half the polling places, it will be almost as if we had done nothing. So we'll need to make sure that as many polling places are open as possible so that we're able to really spread out those crowds. And so we know that polling place congestion is likely to disproportionately threaten the health of voters of color who tend to utilize in-person polling places the most. Maintaining these in-person options is absolutely critical. But it still means that we need to make them safe by spreading out and minimizing crowding as much as possible. So that means extending voting days and hours, and then of course what I had mentioned before around increasing the points of service and transaction time in individual polling stations. And then, of course, we should make sure that all polling stations are complying with CDC best practices for safety around sanitation, mask wearing, social distancing, etc. But of course, it is difficult. We are in a pandemic, and election officials are having a hard time securing as many polling places as we would like. So there may need to be some amount of polling place consolidation. We cannot have the amount of polling place consolidation that we saw in Wisconsin, where we went from 180 places to 5. But if there does need to be some amount of consolidation, there are a couple of factors to consider, specifically prioritizing equity and anticipated demand. So we should be putting polling places in places where we know people use them, where there are higher rates of in-person use, as well as in historically disenfranchised communities. We should compensate for any consolidation by expanding early voting hours and days and ensuring there are more machines per location to increase points of service. And so that could mean maybe potentially selecting larger buildings or multi-building campuses so that it is easier to social distance if there does need to be some consolidation. And finally, of course, making sure that they all comply with CDC guidelines. And finally, no change to an election system is successful unless voters actually know about it. So states must ensure that they're earmarking funds to reach out to voters, especially because this type of voting, absentee voting or changes in polling places are going to be new to a lot of voters. And with so much going on in the world, voters will really need a robust education campaign to make sure that they know how they can safely and securely cast their ballot in November. So we need to make sure there's clear, accessible information on the voting process that should be sent via a variety of channels, media, direct mail, at different times, and made available in multiple languages and written in an accessible way. This is an example of the Secretary of State from Nebraska using social media and memes to try to get through to people. And so just as much as election officials across the country can make proactive steps to educate voters as soon as possible around how to vote safely, it's absolutely critical. And with that, I will pass it over to Ryan.
Thanks so much. for having me and for all of your work on these issues. Investigator and advocate to be able to cite to the work you all do in informing access to democracy during this public health crisis. These are issues that we're at the Lawyers Committee are dealing with every day in the courts and under work with communities and election officials. Again, my name is Ryan Snow. I'm a legal fellow in the Voting Rights Project of the Lawyers Committee for Civil Rights Under Law. A big part of my work is focused on election protection, the coalition work we do through election protection. So I'm going to start with just an overview of what that work looks like before touching on some of the legal issues raised by the pandemic and how they are playing out in the courts. Election protection is the nation's largest and longest running nonpartisan voter protection coalition. It was founded in 2001. It is a nationwide year-round effort to ensure that all voters have an equal opportunity to vote and to have that vote count. It's made up of more than 100 local, state, and national partners. And I'm going to just put this list in the chat. I don't have slides, I apologize, so I'm going to be some links and other information in the chat. So election protection uses a wide range of tools and activities to protect and advance and defend the right to vote, anchored by our 866 Our Vote hotline and other hotlines run by coalition partners that provide support to voters in 11 languages. The Election Protection Coalition, led by the Lawyers Committee, also carries out work through voter education, advocacy with election officials, field program, including roving poll monitors, and litigation where necessary to protect the right to vote. I'm also going to put the hotlines in the chat. Through. So election protection through the hotlines and through the field program provides comprehensive information and assistance to voters at all stages of the voting process, from registration to absentee and early voting to casting a vote at the polls, and to overcoming obstacles to their participation in all of these steps. Election protection helps voters make sure their vote is counted through a number of different programs, some of which I mentioned, and volunteers providing information, but also document problems they encounter, that voters encounter when voting, and work with partners and volunteers on the ground to identify and remove these barriers. So our program consists of thousands of legal and grassroots volunteers, including field program, with on-the-ground volunteers monitoring poll sites on election day. Obviously, the pandemic has altered some of these processes. We're conducting drive-by monitoring and physically distanced in-person voter assistance and advocacy with election officials where needed. But much of our program centers on the hotlines. So we receive thousands of calls each election, sometimes tens of thousands of calls. In the 2016 election, we received 117,000 calls. So it's a very robust voter information and also issue monitoring system. So we provide voter information comprehensive throughout the process of voting and also through all states. And we also conduct legal monitoring and response, and that's a big part of my role as an attorney, which the response can include direct advocacy of election officials or where necessary litigation. And an important point on this, and it was mentioned earlier, but the June 23rd was the 7th anniversary of the Shelby County Beholder decision. And of course, the big aspect of that was that it removed the coverage formula that was used to effectuate preclearance, through which covered jurisdictions needed to obtain preclearance from the Department of Justice before enacting changes to voting, which was, of course, a very effective tool to prevent voter suppression and ensure equal access to the vote since the Voting Rights Act was passed in 1965. But another aspect of this program that was affected by Shelby County was the Department of Justice's legal monitoring efforts. And the Department of Justice for decades had a very robust legal monitoring program, sending thousands of attorneys to covered jurisdictions. And as a result of the invalidation of the coverage formula, the DOJ no longer conducts this robust program. So one of the important roles of election protection is the monitoring aspect and an information collection and information forcing aspect where the Lawyers Committee and our coalition partners are hearing information about what voters are reporting, as far as barriers that they're experiencing. And this is very often how we hear about issues. And if we don't hear about them, we're not able to address them. So this is a very important program, and one aspect of that is ensuring we have as wide coverage as possible in the hotline. If a community is not aware of this hotline, they're not able to report issues, and we're not able to respond to them. So, I shared the numbers in the chat. I please, would urge all of you to share this information widely with your communities, and through social media and all channels. So I mentioned some of the legal responses. This can include rapid response on election day. I see there's a question in the chat. We work proactively with election departments, especially with our state partners. Let me be a little bit clear. The Lawyers Committee is a national organization. We have national partners, but we also work in state coalitions in 32 different states made up of state and local organizations. These organizations are working year-round to develop these relationships with election officials, and from an advocacy perspective, from an accountability perspective, and a partnership perspective, because really, we have a shared goal, which is competent administration of elections that don't end up disenfranchising any voter. That each voter is going to have equal access to our political process, and meaningful access. So it's a proactive relationship. It does sometimes result in conflict and litigation, because there are some issues that are either the election officials are bound by state law, and as I'm sure most of you know, our elections are administered at the local level under mostly state parameters. There are of course federal law and constitutional parameters as well, which I'll touch on a little bit later. But it's really a locally administered process. So sometimes some of the barriers we identify, we need to sue because it's a state law that's unconstitutional, and the local administrator doesn't have a choice about how they do it. So a lot of the work we do through election protection is about identifying patterns. For example, if we hear from a number of jurisdictions a number of voters in a jurisdiction that they have submitted their voter registration forms by the deadline, but it wasn't processed, and they've received a note that they're not registered for the upcoming election, or if we hear that voters who have been previously registered are not now checking the registration and they're seeing it's not there and they don't know why, things like that would be a red flag that we would follow up on. And some of the voters who call in the hotline end up serving as plaintiffs or witnesses in litigation. And also this information that we collect facilitates a top level analysis. I'm going to keep moving quickly as I can. So let me just say, again, just kind of field pitch. Please do spread the hotlines, and you can also volunteer. We work with legal volunteers, and we also work with grassroots volunteers. I'm going to put the volunteer sign up links in the chat, and I'm also going to include my email. Please feel free to ask any questions, following up from. So turning to barriers to voting during a pandemic, a lot of these issues have been touched on by my co-panelists. Try to focus on some of the legal aspects and out of this. So barriers to voting can arise at any point in the process, and much of my work at the Lawyers Committee is focused on identifying these barriers, whether it's as I mentioned, something that's reported by a voter, or a state partner that's focused on issues in a particular state or local jurisdiction, or we monitor legislative developments and new laws that are passed and how they fit in with the rest of the state's scheme, and whether it comports with federal law and other aspects of state law. So barriers to the voting process during a pandemic. In-person voting. Many of the issues around potential exposure at polling places have already been covered. So I won't spend too much time on that. And I think we understand, that it is burdensome to ask a voter to risk their health to vote. I think this is pretty intuitive. It shouldn't be controversial. But this is an issue that we are having to make to courts. We have to, present facts and make the arguments. And we've had, unfortunately, mixed success in convincing courts that this is a problem that needs to be fixed by the courts. I wanted to mention quickly and focus on polling place consolidation, which I know has been touched on previously, but this is, I see a note that I'm fading in and out. I apologize. I'm going to try to speak loudly and clearly. I have had some issues with my mic in the past. Please let me know in the chat if it is fading out again, and I'll do my best to make sure that I'm heard. And again, apologies. But polling place consolidation is obviously, it's a big issue in 2020, but it's an issue that we have a lot of information about the impact of, because it's an issue all the time. And you know, as touched on by other panelists, it's an issue that, of course, affects different voters differently, and has a disparate impact on voters of color in particular, as well as young voters and low wealth voters due to limited access to transportation, healthcare, childcare, inflexible work and school schedules, healthcare also, as you're well aware. This is in part because different voters experience voting costs differently. This is a political science and economics theory called the calculus of voting, which discusses not just monetary costs, but the opportunity costs of time spent acquiring information, navigating processes that are prerequisite to voting, whether it's registration, obtaining ID, applying for mail ballot, et cetera. All of these voting costs have increased, sometimes significantly, due to the pandemic. But polling place consolidation is particularly significant barrier because if you're used to voting at the same location, whether it's a local church or a middle school, and now you're told you have to go to the government building across town, that obviously is a transit cost increase, but it's also a comfort level increase. And this is, again, affecting communities of color, and many of whom have less experience voting by mail, and also who experience problems voting by mail disproportionately to other voters. So let's turn to voting by mail, because I think it's a big issue, and it's a big part, it needs to be a big part of the solution in 2020, but there are a number of issues with it. So from the voter's perspective, what are some barriers to mail voting? Obviously, if you're not eligible to vote by mail, you can't vote by mail. And many states still have restricted eligibility to vote by mail, or have expanded eligibility to vote by mail, but retained some restrictions. For instance, Mississippi is a state that I focus on. Mississippi has created a new eligibility exception for 2020, but it is limited to voters who are in physician-imposed quarantine, is the language. This is not well defined by the law, so it's potentially creates legal or criminal liability for voters if they are attesting under oath that they are in physician-imposed quarantine, but they're not fitting whatever definition applies under the statute. But it's also, of course, doesn't catch asymptomatic voters. It doesn't catch voters who may be symptomatic, but they don't have a doctor's note, or they're not able to get a physician determination of this. So this is obviously not a sufficient step to take to remove this barrier to voting based on eligibility. There's an application aspect to voting by mail, which is in some states very burdensome. For instance, in Mississippi, again, you need to actually have your application notarized. You need to get an official application from the county with a stamp on it, and you need to take it to a notary and get it notarized and send it back. You need to do the same thing with your ballot. That turns to attestation requirements. Many states have attestation requirements for ballots, whether it's a notary or another official, or it's another voter, or another adult citizen. For voters who are quarantining because of the pandemic, this is still a very burdensome barrier, because it means that they have to expose themselves to potential infection in order to participate. Various return options. This was also touched on earlier, whether you have a ballot drop box, whether it needs to be mailed, whether it needs to be mailed to a specific location, where they can be dropped off at the polling place on election day. That touches on deadline issues. Many states have a election day receipt deadline. Thankfully, only 2 states now, Mississippi, actually addressed that problem. They changed to a postmark by election day, received by 5 business days after election deadline. But Indiana and Louisiana still have a receipt deadline that's before close of polls on election day. But if you receive your ballot, if you apply for a ballot and you don't receive the ballot until a few days before Election Day and it's due on Election Day, you're not going to be able to return it by the mail necessarily. You can't trust that. So you're going to have to do some kind of drop-off in person, whether it's at a drop box or a polling place. And then another issue to think about here is notice and cure for rejected ballots. If you have a signature mismatch or if you have some other deficiency with your ballot, many states don't require notice to be provided to the voter of this, and many states don't have a process for the voter to cure this ballot. So by the time they realize that their ballot isn't counted, they were never notified that there was some issue with it, and they never had an opportunity to cure that. There are other problems with or other barriers associated with mail voting related to accessibility, and this is also touched on, but just to flesh it out, voters with disabilities often have difficulty voting by mail. Voters who have unreliable mail delivery in normal circumstances, let alone the pandemic. This includes Native voters, this includes rural voters, low wealth voters, especially voters in multi-unit housing, which rely on bank mailboxes that if one mailbox breaks, the Postal Service cannot legally leave mail in that postal box. And again, of course, this disproportionately affects voters of color. And a lot of voters aren't familiar with this process. And if you're not familiar with it and you're trying to do it on the fly in election season where there are mail delays and there are other administration challenges, you're going to have difficulty with that. From an election administration perspective, many of these jurisdictions are scrambling to put in place a widespread vote by mail process. There was a recent report issued by the United States Postal Service, the Inspector General, reviewing Wisconsin's April 7th election, and found a number of different issues related to the handoff between election officials and Postal Service. Oftentimes election officials contract with a third-party vendor to handle mail voting. So there's even another step between a handoff there. And then of course, back to the voter and then back to the system, back to sometimes the third-party vendor and back to the election official. Sometimes these ballots are having to go across the country before they come back to the jurisdiction. There's issues at the local election administration level. And unfortunately, there are issues at the United States Postal Service level. This is an issue that I've been increasingly focused on and very worried about. Obviously, the United States Postal Service is already dealing with a limited capacity. The pandemic further affects that capacity as it affects all of our institutions and individuals. And at the same time, we have a significantly increased volume for election mail. I won't go into detail about examples of this, but I'll also mention that there are some new policies that have been announced in recent days that threaten to dramatically increase the delay. For instance, the new politically appointed Postmaster General has released a memo stating that there will no longer be overtime pay for postal workers, and the memo explicitly told postal workers to leave excess mail for the next day rather than stay late to finish it, which used to be the policy. This is extremely concerning because it will lead to a snowball effect. With compounding delays day on day of mail that cannot be dealt with except during normal working hours. What are some remedies for this? I mean, we have states that conduct all-mail elections, and we also know that there are Postal Service policies in place in those states that are designed to ensure that some of these issues don't occur. For instance, in Colorado, in Denver, the main mail processing center in Denver, a recent report revealed that there's a policy in place whereby a USPS official and a local election official do a walkthrough, a sweep of this facility prior to the close of polls on Election Day, and regularly discover up to 1,000 ballots that have been misplaced, that are just left in the system that wouldn't be counted otherwise. This kind of a policy would have prevented a lot of the issues in Wisconsin that were identified in that Inspector General report, where we have buckets of ballots that are sitting around that aren't able to be transmitted through the mail to the election office. But if you had a sweep like this, you could literally just take them there. That's just one example. I want to move on because I know I'm running out of time. So the legal perspective, courts can provide relief when the right to vote is implicated, but there are unfortunately increasing barriers in courts even to this. Obviously, with a number of voter unfriendly judges have been appointed. and we're seeing the results of this every day at the Lawyers Committee and in voting and other contexts. But there are also a number of issues created by the pandemic that courts have signaled to varying degrees that they are willing to address. One quick background note on the legal standard. So that the fundamental right to vote is guaranteed by the First and 14th Amendments to the U.S. Constitution. But this is not like, speech where if it's there are certain restrictions that are tolerated, but it's essentially strict scrutiny and it needs to be justified by a compelling state interest. It's a balancing test. So it's the balancing test under the Anderson verdict standard, which is 2 cases from about 30, 40 years ago. In evaluating claims asserting that a particular election law or practice constitutes an undue burden on the fundamental right to vote, courts have to weigh the character and magnitude of the asserted injury against the precise interests put forth by the state, taking into consideration the extent to which those interests make it necessary to burden the plaintiff's rights. So, however slight the burden may be, it must be justified by a relevant and a legitimate state interest that's sufficiently weighty to justify this limitation. In practice, so this is a sliding scale level of scrutiny, but in practice, this means that the court has to make a preliminary determination of how severe the burden is before they even decide what level of scrutiny to apply. So it's a little bit of there's a lot of wiggle room there, and it's been applied very to varying degrees of strictness. There's another factor here, which is called the Purcell principle, and that is that courts should not alter election procedures so close to an election that it might, the rationale being that it might confuse voters and drive down turnout. This rationale featured prominently in the RNC v. DNC decision that the Supreme Court issued in Wisconsin, that I won't, I'm running out of time, I won't spend too much time talking about in detail, but essentially the court said, the district court had issued a ruling the day before the election that created extra process for voters and extended the deadline for receipt for mail ballots. And the court said that, the Supreme Court said that courts should not be doing this. Election officials can do it, courts can't do it. And unfortunately, in the ruling, not only didn't discuss the pandemic conditions, which were of course the complete predicate for this decision by the district court, responding to burdens on the fundamental right to vote that were created, not in principle by a law or election administration, but in the context of the pandemic were very burdensome. The ruling did not even use the word pandemic. So it treated this as this very isolated technical issue, and it essentially signaled that it was not, the court's not willing to take that into consideration. One silver lining of this ruling is, despite its protestations about court altering election procedures, the ruling of the Supreme Court did actually order that, contrary to the district court's ruling, which allowed simply a receipt deadline, which created the condition where a voter could actually postmark or vote a ballot after Election Day and have it be received by 6 days after Election Day in this case. The court said Election Day is a backstop. It needs to be postmarked by Election Day, which there's no such restriction under Wisconsin law. So that's actually a silver lining in the Supreme Court endorsing a Election Day postmark deadline as a backstop, which is, of course, as I mentioned, there are a number of states that have a Election Day receipt deadline, which in the context of these mail delays is particularly burdensome. Another case that's worth highlighting in the context of the pandemic is the case out of California on restrictions on large gatherings in public spaces. This is the South Bay United Pentecostal Church v. Newsom case. Of course, this is not a voting case, but it's, and it's an interesting ruling in part because Roberts sided with the four more liberal judges in upholding the state's restrictions on public gatherings and saying it wasn't discriminatory in violation of religious freedom. But part of Roberts' ruling, and this is the part that wasn't joined by the four more liberal justices, essentially stated that, I can read, the precise questions of whether restrictions on a particular social activity should be lifted is fact intensive, and it's one that is delegated to the states. Essentially, it indicated a huge amount of deference to the state in determining what policies are necessary to in a given case, which implicates constitutional rights. So applied to the voting context, this is very concerning because it essentially, it signals that the Supreme Court, or at least the majority, is not going to be willing to, is not going to be willing to question states' judgment in terms of what safeguards are necessary in the context of a pandemic. This is obviously concerning. There's another couple issues I can touch on, but I know I'm running out of time, so I think I'll leave it at that, and then we can maybe leave some time to question and answer. So thanks very much.
Okay, thank you so much, Ryan, and to Dawn and Jiggy as well. So we have about 20 minutes left for some questions. I'm going to go in the order that they were sent in. Thank you so much, everyone, for writing in questions so that we can continue the discussion, which means that Dawn, you are up first. So we first just have a quick request. If you have fact sheets or literature reviews or citations that you could provide, would it be possible for us to include those with the webinar materials after we conclude today?
Yes, we can definitely include some links, and there's some great literature out there. I'll just say, two of the easiest things that people could look up are on the CDC's Healthy People 2020 website. There's a page on civic participation, and there is a separate page on social cohesion, and those both give really good background information for how those things relate to health.
Great, thank you. Okay, so another question. Who has the authority in the states that you listed at the beginning of your presentation, Dawn, to postpone elections or change polling sites? Iowa, for example, has changed election dates this year due to COVID-19, and local auditors have changed polling sites.
Yeah, so generally it's the Secretary of State or other elected statewide official for elections, or a state election board that has that authority. Under COVID-19, governors also are using their emergency authority granted under declarations of emergency to also make elections modifications, which is why I included both slides. So that actually creates a lot of tension. I'll post a link. There's a great article that is that is called "Who Has?" I think it's something like "Who has authority over elections?" It's hard to say. So it's hard to say who. So, but generally the Secretary of State, and then in an emergency, the governor.
Great. Thank you so much. So next up, we have a question that I think everyone working in the voting rights space right now has probably been thinking about. Can an otherwise qualified voter who refuses to wear a mask or social distance in a polling place be, oh, sorry, y'all. The scroll thing is very sensitive, so I keep accidentally scrolling down too much.
I was doing that too, so no worries.
Yeah, it's tough, right? Be denied access to the polling place was the last part of that sentence.
So I'll answer that, and then if Jiggy or Ryan want to also comment. We would hope to say that no, voters would not be turned away, but we actually have seen reports in states that that's happening. It's really incumbent on the Secretary of State to give guidance to local elections officials on allowing people to vote, even if they don't have a mask, and then to offer alternatives to voting. Either asking them to go to a separate location, encouraging PPE, handing out PPE to voters, making sure there are lots of alternatives so that we're supporting people's right to vote as opposed to suppressing it. But definitely expect that we'll still see in locations that some voters might be turned away. And that's something that's up to local elections authorities to make sure that they're giving really clear direction.
Great, thank you so much. Okay, another question that we have for you, Dawn. That $400 million CARES Act allocation, does the state have to apply? Local jurisdictions can't. Iowa has recently expressly taken away the Secretary of State's ability to send ballot requests to everyone in the state, as he'd done in the primary. Recently passed and signed legislation prevents this, so I don't see Iowa applying for something to encourage voting, particularly with a 20% match. So would local applications be possible in a case like this where the state is not going to participate?
So fun fact potentially is that all states actually applied. I'm going to post the link. You can actually see the letter that your state submitted to request the funds. And then several states, including Iowa, have actually already issued a report on how they've been using the funds. So I'm sure the person from Iowa who submitted the question will have an interesting perspective on the ground versus what was submitted in the report. But generally it goes to the state and then is distributed to local elections officials for use to support modifications or safety precautions for the elections.
Great, thank you so much. And do you have a list of mail service providers who have handled vote by mail before that can track ballots?
So I think that one is for Jiggy potentially.
Mm-hmm. Oh yes, probably is. Thank you.
Yeah, so the National Vote at Home Institute does a ton of work with elections officials on implementing vote by mail across the country. And it was started by the former clerk of Denver, who pioneered a ballot tracking software in Denver. So I'll post a link to the National Vote at Home Institute, but they have a lot of resources around kind of like the more technical details of implementation of vote by mail.
Thank you so much. And could you also please address the issues of increased in-person voting and contact with the issue of limited room capacity restrictions, which some states have enacted statewide? Is this something that's potentially going to come into conflict with each other?
Yeah, I can start and other folks can jump in as well. I think the key here is that so there are if we keep the same number of polling places, ideally we are not going to be seeing crowding that will lead to some of those capacity restrictions. There are some states that are now moving to like larger voting locations that can accommodate social distancing, so like giant shopping malls or conference centers. This gets at something that Ryan was saying though, is as soon as you start changing people's polling locations, you're kind of changing their comfort level and you're changing kind of like their habits. So we have to be careful about balancing those two things. There's also some issues around people often vote at schools, and in some states, schools being used as polling places is also being limited. So unfortunately, there is going to have to be likely some changes in most states just due to the situation that we're in. But as much as we can minimize it, and then when there are changes, trying to accommodate for social distancing in larger locations. Donna or Ryan, you have anything to add?
I would just add that the upside and downside potentially of the primaries is that we have lots of data on how it didn't work and how many people turned out. So really states have no excuse now not to make modifications before the general election based on the data that we had from the primaries. I'm a huge data nerd, and I think it's really important that that the data are used to inform changes for the remaining elections.
I'll just add that the voter education piece is key. It's always key. It's never been more key, and it's also the problem there is that it's kind of everybody's responsibility, and it's not necessarily clearly defined. It's qualitative, right? So do to make sure voters know how to navigate the process, and certainly there are circumstances where you can't the polling location. But then what needs to be done to make sure that the community that's served by that location knows where to go and what other options there are if they can't make it.
Great, thank you. So this is kind of a fun little speculative imagination game that we're all going to get to play right now. So what do you all think about the idea that presumably we're going to have more absentee ballots than we've ever had before? Do you think that might help avoid demotivating voters on the West Coast because results will not be as clear on the East Coast as early?
I feel like the argument's usually the opposite. It's usually when early returns come in on the East Coast, that's what demotivates voters on the West Coast because they see, oh, well, it's decided. Right. I think if anything, if we all prepare ourselves that, for the reality that we're not going to know necessarily the outcome for a week or more, that almost has an equalizing effect.
Oh yeah, I'm sorry if this wasn't clear. That was what this was Douglas Escobedo was positing, that that might help avoid that issue.
I see. Yeah, I agree.
Yeah.
Sorry.
Go ahead, Jiggy.
I was just going to say that is something we should all prepare for, which is because there's going to be a huge surge in absentee ballot use, which is a good thing for this election. We're not going to have results at the 10 o'clock news, the Eastern time that people want it. I think voters on the West Coast, myself included, are used to not getting returns because I live in California and it's always weeks later that we get our results. But I think we need to start kind of preparing nationally for that reality.
And I would just say from a messaging perspective, that's something that actually organizations can use to help drive messaging to voters that your vote counts every time you vote. But now, definitely knowing that we're not going to know the outcome for a week or longer, it matters that you stay in line, that you get your ballots in on time, et cetera. So definitely an opportunity to create messaging campaigns around that this year.
Thank you. Yeah, I think that, oh, go ahead. Sorry, Brian.
Just a real quick note, I think one of the things that the Election Protection Coalition is focused on, in particular Common Cause, is misinformation and disinformation around the election. And this also includes misinformation, disinformation around the pandemic and around the census. But as far as the election, I mean, the period, obviously in the run-up to election day, but from election day until when we have a clear determination of the winner, is going to be a period of just chaos in terms of election misinformation and disinformation. So that's something else that we should kind of prepare ourselves for mentally and frankly emotionally. And also, there are, like I said, the coalition that I'm working with is taking steps to mitigate that. But there's a concept of inoculation where once misinformation is out there, it's actually really difficult to bag because of the nature of social media spreads it very far and wide. So steps we can take, whether it's in our communities or at a more national level, to inoculate voters to the fact that they're going to hear a lot of misinformation during that time, should be helpful.
Thank you. And we have one more question in our last couple of minutes. Sorry, scrolling issue. Would any of you be able to address any recent movement in the voting eligibility of those who have records in the criminal justice system, including people who are currently incarcerated?
DC actually just became the newest not state to allow people who are currently incarcerated to vote. Before that, it was just Maine and Vermont that allowed, that never took away the right to vote, and now DC has joined that movement. There are a number of states across the country that have been trying to expand voting rights to people with former felony convictions in some capacity. One thing I'm working on personally in California, there's going to be issue on the ballot, Prop 17, that will expand voting rights to people post-incarceration. And there's efforts along that realm in many states across the country. And actually on our website, I'll take a minute to do a pitch. If you go to our website, tracker.votingrightslab.org, we have information about all different voting issues, including voting rights restoration, and where you'll be able to see kind of the trends of different states and what they're doing in that.
I would just add that a good resource is the Sentencing Project. They have a good report on just the status of disenfranchised people in the US. There's about 6 million people who are affected. I think 12 states that actually disenfranchise people beyond sentence completion. I live in Florida. Florida is probably one of the strictest, if you will, states in terms of disenfranchisement and restoration of rights. And that's something that I mentioned in part because August 18th, we're expecting a hearing from the 11th Circuit challenging a ruling the district court that basically said it's unconstitutional to restrict the right to vote for an inability to pay fees and fines. And so that's currently being litigated. Unfortunately, that hearing coincides with the primary here in Florida. It will be important for the general election, and so that website actually also is a good resource in addition to the Voting Rights Lab website.
Thank you so much. Okay, so
I think Ryan was going to add something there.
I apologize.
Just real quick. I mean, Florida is one of the states I work in, so I've been thinking a lot about the case that Don just mentioned. But I also work in Illinois, and Illinois actually has a relatively robust, or at least in some counties have a relatively robust jail voting program for folks who are pre conviction. And this is actually something that was significantly impacted by the pandemic. And our Chicago Lawyers Committee for Civil Rights Partners, they've been working with Cook County jails for a long time to have a really robust program of not only jail voting, but jail voter registration. And it's been really successful in doing that. And this is something that had to be scaled back because of concerns about bringing in the virus from outside. But I think their approach and our approach to flag on this is it's really important to listen to the communities that are in the criminal justice system about what advocacy needs to happen and what solutions they want to see, and really center that experience, because these are some of the most vulnerable members of our society.
Absolutely, thank you. Okay, so thank you all so much for answering these questions. That's actually all the questions we had. So I think if y'all have anything else you'd like to comment on or close with, we have a couple minutes left. Otherwise, we can wrap early.
I guess my final comment is that for those of us who work in voting rights advocacy and all day, it's definitely stressful thinking about how to make sure the November elections are safe and successful. It's a very important election, but I think we can do it with the help of public health officials and election officials across the country. I think the primaries have been a really good case studies. And so not all hope is lost. I think we can do it. It's just a matter of making the right changes and really prioritizing public health.
And I would just add that, elections determine the distribution of resources in a society, and the distribution of resources is what determines who has power. And I think that's really important part to think about, having the resources to have better health outcomes, to address the social determinants of health. Civic participation and voting in particular is a key strategy to achieve that.
All right. Sorry if there's any background noise. My dog is running around the room. Okay, great. Well, thanks everyone so much for attending. As Charles mentioned at the beginning of the webinar, we are going to have the slides and recorded presentation available on our website, so please feel free to share that if you have any interested colleagues. And thanks so much again to our, I'm sorry, and thanks so much to our presenters. And if we could also, along with the fact sheets and citations, include the graph that we had in the slides about the difference in voting times between folks of color and white people, that would be helpful. We've had a request for that as well, which I did not mention. So I think we should be able to isolate that without a problem and include it if we're including other materials as well. Is that right, Dawn? Okay.
Yeah. Mm-hmm. And is Charles on?
Yes, I am.
Okay.
Thank you all again for just a really insightful and wonderful presentation.
Right.
There it is.
Thank you.
Thank you.
Just like Lauren said, the video playback will be available on the website shortly, as well as all of the webinar slides and accompanying materials. You will all be receiving an email from the network with that information, as well as our survey. So the survey just takes 1 minute to fill out and gives us some really great insights, especially in regards to what topics you might be in for future webinars. So be sure to fill that out. And just a really quick plug that the network is hosting a virtual summit on COVID-19 response and recovery this September, and registration will open for that summit very soon. So you can sign up for updates on that at networkforphl.org/summit. So that concludes today's webinar. Thank you all for attending. Have a great rest of your day.
Thanks so much, y'all.